Despite a scarcity of vaccines right now, the federal government is sticking to its plan to vaccinate people on remote First Nations and Métis and Inuit communities by this spring. There are more than 3,500 active cases of COVID-19 on First Nation reserves. 144 people in those communities have died. About 37,000 people in 196 Indigenous communities have received the first dose of the vaccine. Shortages and logistics are two big challenges, but so is a long history of racism and mistreatment that's left a legacy of mistrust in Canada's healthcare system. Couteur reports, and a warning: some of the images in his story may be disturbing.
If the real coronavirus enters our body later...
As the COVID-19 vaccine rolls out to Indigenous communities, so too is an information campaign, including pictures of chiefs and community leaders getting their shots. Some of it may seem hokey, but it's to counter a history.
Vaccine confidence is something that has to be earned in Inuit communities.
Naten Obed represents Canada's 60,000 Inuit, while communities like Nunatsiavut in Labrador say 71% of the adult population has been given the first dose of the Moderna vaccine. There remains distrust.
Considering the experimentation on Inuit, First Nations and Métis children in residential schools, especially on nutrition supplements and other health research projects.
Working against legitimate fear of the healthcare system in terms of vaccines and deployment of the vaccines in a culturally safe fashion.
Those experiences have been passed down through the generations, and there's been a more recent example. Video of Joyce Echaquan being insulted and degraded by hospital staff in Quebec exposed the systemic racism Indigenous people face in the healthcare system. It prompted a two-day meeting between governments and stakeholders, resulting in a path towards distinctions-based Indigenous health legislation.
The issue of self-determination over healthcare is key, foremost as a matter of right, but also as a matter of positive medical outcomes.
Outcomes like a safe and effective vaccine rollout to all Indigenous people, even those living off reserve in urban settings. The National Association of Friendship Centres has offered to set up vaccination clinics to reach those people, but there have been issues.
The day before the clinic was supposed to happen, the hospital that was providing them with the vaccine said, the province won't let us give you some of our vaccines.
That clinic alone would have immunized 60 high-risk Indigenous people in Toronto. Instead, it had to be cancelled, and those individuals are supposed to be the top priority for vaccination, according to both the province and the country. Couteur, Global News, Ottawa.